Now, this is another case. So 7-year-old girl presents with sudden fall to the floor at school and, the inability to fully move her limbs. It's like she was not able to move. It became limp. So she had a similar episode 3 years ago as well, self-resolved. In between, she was fine. When she fell down, no history of head injury, no loss of consciousness. She was awake throughout. The GCS was 15 on arrival of the paramedics. While there, everything was fine. But they did say that, there was a lot of weakness. She was not able to move her limbs. So she was borderline febrile at 37.8, and there was a history of slight sore throat, but nothing unusual. The power was reduced to 3.5 and 4/5 in upper and lower limb respectively. So there was a family history of asthma and eczema as well. Standing and lying blood pressure was 100/63 and 98/65. So not much, differences in standing and lying blood pressure. Dad was from Middle East. He was, I think, from Turkey somewhere, and used to have there was a history of drop-like attacks in his youth as well, though he never had any attack while being in the UK. So with this thing, what would be the next back step? In terms of investigation, what should we do?
Was the ECG done?
Yes. Coming down to that.
Prolonged QTC?
How can you calculate prolonged QTC on this? The image is very, very faint, I think.
We'll take your word for it.
If you look at
the one.
Yes. Yes, Gupta?
If you look at the rhythm, the QTC, at least just from there, you can see the U waves too. I think it's slightly prolonged, the QTC. It could be congenital prolonged QTC.
Okay. So you think there is an element of prolonged QTC here?
Yes, yeah.
Okay.
Other thing to look is hypokalemia. Drop attacks can happen with hypokalemia.
Yeah. So what point goes in favor of hypokalemia here? Can you see anything?
The U waves.
Yeah. So if you see, in the limb leads, even in the in the chest leads, there is flattening of the T wave. You can't make anything much of the T waves. Sometimes you don't even know if the T waves are there or not. You feel like it's a sine wave sort of thing. Whether the T wave is inverted or whether it's late. Obviously, apparently feels like that. Probably there might be a prolonged QTC.
Yeah.
If that is the T wave, but I don't know. Look at V4 and V5. So there is a lot of look like a sine wave.
Yes.
So that goes more in favor of probably, and it might be a U wave as well. It's very difficult to say. So
yeah,
how should now what should be the next step after the ECG now?
You got to do the electrolytes.
Yes, electrolytes. So yes. This girl had a potassium of 2.3.
Yep. Yeah.
So now, if we connect all these dots, what is the diagnosis?
Periodic paralysis.
Exactly. Yes. So familial periodic paralysis. Obviously, the dad has a dodgy history. Was never diagnosed, but so it was brought as the initial thought was vasovagal syncope. But then this ECG, looking at the ECG, actually turned the tide. So looks like either a QTC or anyhow, hypokalemia can cause prolonged QTC. It's one of the risk factors for for prolonged QTC acquired. So this girl had periodic familial periodic paralysis caused by hypokalemia. So it's not a frank paralysis, just weakness of the upper and the lower limbs. Sometimes one can be more than the other one because it's not a uniform side of a thing. They might be having more difficulty picking up, moving their upper limbs and sometimes the lower limbs. If it is lower limb, then obviously they would not be able to walk, and that causes them the drop attacks as well. So all of a sudden, the muscle power goes away. They don't. But the good thing was she didn't pass out that time. So that was another one thing. In vasovagal, they usually pass out for a few seconds. So this was familial periodic paralysis caused by hypokalemia.